Hello, everyone. You're most welcome. Today, I'm going to introduce to you the principles of diet therapy, the first lecture in Diet Therapy 1 as a course unit. And I would like us to understand the meaning of diet therapies and the objectives of diet therapy. And then finally, we shall look at the types of therapeutic diets in detail. So, generally, diet therapies are specifically designed diets that are prescribed for medical and/or general nutritional reasons. So when we talk about diet therapies, we mean a type of diet that is specifically prescribed for a patient depending on the condition that they are suffering from. For example, a diabetic may be recommended a certain type of diet that is specific to the sickness that will help that patient to cope with the disease and possibly reduce the symptoms and with time bring healing to that individual. Diet therapy promotes a balanced selection of foods that are vital for good health by combining foods appropriate for each individual, specifically for those with special medical and dietary needs. So, one of the objectives of diet therapy is to make sure that this diet provides a balanced selection of nutrients that are vital for the good health of that individual, depending on their condition. If it is a hypertensive patient, we shall focus on a low sodium diet, and we can even recommend a DASH diet. So you find that this diet will give all the nutrients without compromising the different conditions the person is suffering from, and also with maximizing the health situation of that patient. The objectives of diet therapy, one is to increase or decrease body weight. You can recommend a patient a diet in order maybe to lose weight or to increase. If someone is very underweight, for example, in a context of malnutrition, if a child is severely malnourished, we shall prescribe for that patient a specific diet. And in this case, we have the specifically formulated foods such as RUTF and RUSF. So you find that for a child that is severely undernourished, we shall prescribe RUTF, ready-to-use therapeutic food. And for the patient or a child that is moderately undernourished or moderately wasted, we shall prescribe RUSF, that is ready-to-use supplementary foods. And also, we can use diet therapy to rest a particular organ. If, for example, this patient is suffering from kidney failure, we are going to recommend that this patient takes in foods that are less in sodium and also less in a lot of proteins, because these nutrients make the kidney to function too much, and it will create a burden in the excretion of the end products of these foods. So at the end of the day, we want to rest this organ so that it can come back to function again. We can also use diet therapy to adjust the diet to the body's ability to use certain foods. Then to produce a specific effect as a remedy, for example, regulation of blood sugar in diabetes. So we want to make sure that this patient does not take in too much sugars that will elevate the situation of diabetes. And we can also use diet therapy to overcome deficiencies by the addition of food that is rich in some necessary elements. For example, supplementing a diet with iron when you're treating anemia. In anemia, you find that the body lacks enough iron that is responsible in formation of hemoglobin, the major transporter of blood in the body. So we shall supplement this patient with a food that is rich in iron so that to overcome the deficiency of iron deficiency, anemia. We can also use this diet to provide ease of digestion by omitting irritating substances, for example, fiber, spices, or high fat foods. So what are the conditions where diet therapy is used? One is deficiency diseases, for example, anemia, marasmus, kwashiorkor, or protein energy malnutrition, and then in cases of severe wasting or moderate wasting. And talk about all the other deficiencies that are caused by micronutrients that are lacking in the body, the hidden hunger We shall prescribe different supplements in that case to make sure that this patient receives optimum nutrients. And also in cases of liver diseases and diseases of the pancreas, we prescribe a therapeutic diet. Kidney diseases, for example, chronic kidney failure or chronic renal failure. And then metabolic disorders like diabetes mellitus, gout, and obesity. And also in circumstances of heart diseases like high blood pressure. So we are going to look at the types of diets and the indications for use. The diets used in the treatment of conditions are often spoken of by specific names that will show as special composition and often indicate the purpose for which the diet is intended. So the examples of the diets in therapy that we have are the regular diet. This is the normal diet that everyone consumes, and it could also be a prophylactic diet. So this is the diet that is recommended for all individuals for optimum health and nutrition. And then we have the modified or therapeutic diets. And these include the soft diet, the liquid diet, the high calorie diet, the high protein diet, low calorie, low protein, high residue, low sodium, bland, and then low carbohydrate and high protein diet. So we are going to look at each of these diets in detail. And these are the modified or therapeutic diets that we talk about basically in the concept of diet therapy. The regular diet is basically composed of all the types of foods, and it is well balanced and it is capable of maintaining a state of good nutrition. It is intended for convalescing patients who do not require a therapeutic diet. And the modified diets are modifications of the regular diet and therefore are designed to meet specific patients' needs. So some of the modifications that we can make in diet therapy may include the method of preparation. For example, baking, boiling, or broiling. If you want to minimize the amount of oil in this food, then we are going to make sure that we boil this food or broil it so that we do not use a lot of oil. Consistency. We may have either grind this food into fine pieces that are soft enough for a patient to take in or chop it into desirable pieces. And then the total calories. Here we have to take in the amount of calories that the patient may need. Does the patient require high calories or low calories? And why? On all this will depend on the situation or the disease the patient is suffering from. And then the nutrients. We alter the carbohydrates, the proteins, the fat, the vitamins, and the minerals. And also we allow only specific foods. For example, for a diabetic, we emphasize the foods that are good for a diabetic patient. For a hypertensive, foods that are good for that situation. And so that's why even the names of these therapeutic diets they are named according to the nutrients that we are focusing in. For example, when I say a low sodium diet, I am focusing at a nutrient or a diet that is going to give me less sodium or salt, because too much salt may not be good for the body. For example, in the hypertensive and the person with a kidney failure. So the liquid diet, this consists of foods that are in a liquid state at body temperature. And this diet is indicated in some post-operative cases. After operation, a patient is supposed to take in liquid diets that do not alter the gut. And then also in acute illnesses and inflammatory conditions of the GIT or the gastrointestinal tract. So it's important that feedings consist of 6 to 8 ounces. That is, 1 kilogram will contain about 35.3 ounces. So you have to substitute accordingly or more. And this should be given every 2 to 3 hours while the patient is awake. And these liquid diets are usually ordered as clear, full, or dental diet. The clear liquid totally has no any other solid foods. And then the full liquid diet, you find it is a bit thick. And then the dental diet, the one that is suitable for someone that has no teeth and they can easily swallow it without any difficulty in chewing. So a clear liquid diet includes the clear broth, black tea or coffee, plain gelatin, clear fruit juices like apple, grape, and cranberry, popsicles, fruit drinks, and soft drinks. And this diet is inadequate in all the nutrients because it is quite selective. It only focuses on food items that are clearly liquid. Then the full liquid diets, we include all the liquids that are served on a clear liquid diet. And here we shall also add on strained cream soups, milk and milk drinks, ice cream, puddings, and custard. So the full liquid diet is also inadequate in some nutrients, for example, iron, niacin, and also vitamin A and thiamine. And then the dental liquid diet includes regular foods blended and strains in liquid form, and all foods that are allowed on clear and full liquid diets. And here we shall also include vitamin and mineral supplements that may be necessary in case the recommended amounts of the food are not tolerated. And then we have the soft diet. This one is soft in texture and consists of liquids or semi-liquid or semi-solid foods. It is indicated in certain post-operative cases for convalescents who cannot tolerate a regular diet, and also in acute illnesses and some people with gastrointestinal disorders. So this soft diet is an intermediate step between a liquid and a regular diet, and it's usually low in connective tissue and in digestible dietary fiber. And we make sure that we have little or no spices used in its preparation. And this soft diet includes all the liquids other than alcohol, and also all the foods that may be incorporated into a soft diet may include well-cooked cereals, pastas, white bread and crackers, eggs, cottage cheese, tender meat, fish, poultry, and vegetables. And it may also include baked, mashed, and also scalloped potatoes. So we ensure that this diet is soft. Whatever it is that we want to maximize, we make it soft. Even if you're making the cereals or pastas, we have to make sure that they are very soft in consistency. And the vegetables also can be pureed and the meats are ground for dental patients so that they are easy to chew without difficulty. Also permitted desserts are custards, gelatin puddings, soft fruits, and simple cakes and cookies. And there are some foods that are prohibited in a soft diet, for example, fried foods, raw vegetables, and nuts. And you might ask yourself and find out why this is happening. So, find out most of these fried foods, the raw vegetables and nuts, they have certain ingredients that are not very good for the patient. Raw vegetables are quite hard to chew. So, if you're recommending a diet for a dental patient, then raw vegetables may not be very suitable because they may cause a difficulty in swallowing. Then we have the high calorie diet. This is a diet of a high caloric value compared to the average patient requirements. A high calorie diet may be indicated when there is an increase of total calories required by a malnourished, underweight, post-surgical or convulsing patient, especially those that are recovering from acute illness. Usually the body demands become very high during situations when a patient is recovering, and then for a malnourished child, initially you have to make sure you do not give in too much nutrients because of reductive adaptation. But then as the patient recovers, they may need a very high calorie diet to catch up with the nutrients and the energy that is required to fuel the body organs. And the increase in calories is obtained by supplementing or modifying the regular diet with high-calorie foods or commercial supplements, by giving larger food portions or by adding snacks. So you can also maximize the amount of calories by giving these patients adding snacks on the regular foods they consume and also giving larger food portions at a time. So this diet is basically given to meet a need for energy that is caused by rapid metabolism, and this usually accompanies certain conditions like fever, hyperthyroidism, poliomyelitis, and tuberculosis. So the high calorie diet is often ordered along with high protein. The proteins are added to prevent depletion of proteins in the plasma, and this is the condition known as hypoproteinemia. So proteins are very essential in the body, and when I was discussing the mental nutrients, I also mentioned that it is very important that the body receives enough carbohydrates and fats because the proteins are the last resort for the body. Once the energy levels are depleted from both carbohydrates and fats, the body can then resort to proteins. Why? It's because proteins fuel a lot of functions in the body, and all body structures are made out of proteins. So it's not advisable for the body to mobilize proteins for energy, because they might not perform their work to the maximum. That's why they are always the last resort. So as the patient progresses, you find that a more solid diet may be given. And the good sources of these high calorie foods may include the whole milk, creams, sweets, butter, margarine, fried foods, gravy sauces, and ice cream. Between meal feedings consisting of milk shakes, cheese, cookies, and sandwiches, we may also recommend these foods between the various meals. But this feeding should not interfere with the patient's appetite at mealtime. You make sure that when you are giving these snacks between meals, they should be given as some hours away from the lunch. If, for example, the lunch is going to be at 1 p.m., you have to ensure that you give this patient a snack at maybe 10 a.m. so that by 1 they're already hungry and they can eat enough of the meal at lunchtime. Then we have the high protein diet. First, proteins are very essential for tissue growth and regeneration. So a high protein diet is recommended in almost all illnesses. For example, nephrosis, liver cirrhosis, infectious hepatitis, burns, radiation injury, fractures, and some GI disorders and conditions in which the protein blood level is quite low. And we may also recommend this diet in pre-operative and post-operative cases. In some acute illnesses and disorders, find that, for example, infectious hepatitis, the GI disorders, and the post-operative conditions, the patient may be unable to consume the solid foods or the daily requirement of protein and calories because of the pain and nausea. And that is why we shall recommend a very high protein diet to compensate for the proteins that are not obtained through the diet. So in these cases, the intravenous fluids with nutritive additives are required for the patient to receive the required amount of protein. Protein energy deficiency is a definite factor in the post-operative wound disruption. When a patient has incurred an injury and is undergoing healing, a lot of proteins are going to be used in this process. And that is why the patient will require a high protein diet to replace the proteins that are being used in the repair processes of this wound. And this disruption can be prevented by preemptive nutritional measures before surgery. Antiproduction will also be decreased if the patient receives inadequate protein. And that is why it's important to increase the amount of protein. The antibodies, they are basically made up of proteins. And so in cases of infections, they are very, very essential. So their levels may decrease and they need to be replenished with a high protein diet. The daily recommended intake of proteins for adults is basically about 0.8 grams per kilogram of body weight, and that is about 56 grams per day. And the high protein diet should provide a minimum of 1.5 grams of protein per kilogram of body weight, and that will be approximately 105 grams. So you have to substitute according to your body weight. The seriously burned and radiation injury patients should receive also at least 3 grams per kilogram of body weight. So you can see how the amount is increasing. And then you have to supplement the regular diet with the high quality protein foods. For example, meat, fish, cheese, milk, and eggs. So you can also mash these foods into fine pieces so that the patient can obtain a maximum amount of them. Then we have the low-calorie diet. This is very useful in the treatment of obesity. It can also be used to control weight in medical conditions, for example, arthritis, hypertension, diabetes, CVDs, and also hypothyroidism. A loss of 1 to 2 pounds per week is the medically acceptable limit for weight reduction. You're not supposed to reduce more than this because it may cause health implications to the body. A low-calorie diet will consist of 1,000 to 1,800 calories per day. So the calorie levels are determined by physicians and dietitians, and this will help meet the specific individual patient weight loss goals. The daily intake of proteins should be at least 0.8 grams per kilogram of the standard body weight. And supplemental vitamins may also be ordered if the prescribed diet is less than 1,200 calories. The patients that are on low-calorie diets should be instructed by their dietitian or the other medical personnel knowledgeable in proper eating habits. So these diets are medically prescribed. Then we got the low-protein diet. This low-protein diet is made up of foods that furnish only small amounts of protein and consist largely of carbohydrates and fats. For example, foods such as marshmallows, hard candy, and butter. And this diet is used in renal diseases that are associated with nitrogen retention or liver disorders. We do not want to overwhelm the kidneys in case they are failing to function well. Limited amounts of proteins are also advocated in certain kidney diseases, for example, the chronic nephrotic edema. The low-protein diet for renal failure is usually restricted in sodium and potassium because these two elements are also not excreted properly in this condition. It causes a lot of work on the kidneys. And also in some cases such as the chronic renal insufficiency, the protein content of the diet is varied between 40 and 60 grams per day. And so this will ensure that there will be sufficient complete proteins to maintain the nitrogen equilibrium. And also in some metabolic disturbances, for example, amino acids in the urine, the protein restriction may be of therapeutic value. Then we have the high residue diet. This diet has a high bulk, high fiber, and high roughage, and it is indicated in atonic constipation, hepatic colon, irritable bowel syndrome, and diverticulosis. And it also encourages regular elimination by stimulating muscle tone, creating softer and larger stools that are more easily propelled through the colon, and also thereby reducing the pain and cramping that accompanies hepatic colon or the irritable bowel syndrome. The patient is usually given a regular diet with an inclusion of the high residue foods. And the main sources of fiber that you may include are the whole grain breads and cereals, bran cereals, fresh fruits and vegetables, which are raw or cooked until tender. Whole grain breads and cereals that contain wheat bran have a greater laxative effect than fruits and vegetables because the bran acts to absorb water within the colon, and this will create a bulk effect. The fiber intake should also be increased gradually to minimize potential side effects of bloating, cramps, and diarrhea. At least one serving of 100% wheat bran cereal is recommended daily. Cereals such as raisin bran, shredded wheat, and oatmeal may be used occasionally. And then fresh fruits and vegetables with edible skins such as apples and grapes are also higher in fiber content than the canned fruits or vegetables and their juices. So you have to maximize the fiber. That is why it's called a high residue diet. The dietary intake of refined sugars and starches should also be decreased because they are poor sources of fiber. You also have to make sure you limit the white flour products, the refined cereals, pies, cakes, and cookies. These ones contain very little dietary fiber. And too little fluid in this high residue diet may also cause dehydration and may exacerbate the constipation. So you have to make sure you also regulate. Do not have too little fluids in the body. You have to take in enough fluids. The patient has to drink at least 8 ounce glasses of water or other fluids daily when they are consuming the recommended amount of bran. When you drink too much alcohol and beverages that contain caffeine, such as coffee, cola, tea, and soft drinks, they can also have an irritative sensation on the colon, and they may also cause dehydration. And if possible, you have to use decaffeinated coffees that do not contain caffeine. Then 1 or 2 glasses of water in the morning will help to stimulate peristalsis. This water, you should take it on an empty stomach. When you wake up, just take at least 1 to 2 glasses of water. An excessive intake of foods, for example, dried beans, fruits with seeds and skins, nuts, popcorn, and strong spices, may cause irritability, and especially during the inflammation period of colon disease states. So these foods should be individualized to the patients according to their situation. And when one is progressing from a low residue diet after an acute infection, you have to increase fiber in the diet gradually. You can start by adding about 1 serving of 100% bran cereal and 3 servings of whole grain bread with a low residue menu pattern. And then you can gradually increase the amount of raw vegetables and fresh fruits to at least 4 servings per day. And then we have the low residue diet. This one is indicated in cases of ulceration, inflammation, and other gastric disorders, for example, partial intestinal obstruction or diverticulitis. It is also used in certain post-operative states that may affect any part of the GIT. Low residue diets are also used in treating dysenteries of long duration. The purpose of this diet is primarily to provide non-stimulating, non-irritating, and easily digested material that will leave little residue. And this is going to avoid mechanical irritation of the GIT. A lot of fiber will cause irritation and agitation of the GIT. So in case a patient has a problem with their GIT, then you have to make sure that you reduce the dietary fiber. So you recommend a low residue diet. We have some commercially prepared low residue elements, diets, supplements that may also be given to provide complete nutrition. And then we also have the low sodium diet. This one consists of foods containing a very small percentage of sodium with no salt added in preparation or by the patient. It is impossible to prepare an absolutely sodium-free diet. The low sodium diet is indicated when edema is present, in renal diseases, hypertension, and in certain cardiac conditions. A nephrotic patient is often unable to excrete sodium in normal manners because the kidney's retention of sodium leads to edema. And the low sodium diet may also be indicated with no restriction on salt-free liquids. And some patients should be encouraged to drink about 2,000 to 3,000 milliliters of low sodium fluids daily. And the allowance of sodium in a strict low sodium diet is about 250 to 1,000 milligrams daily. And yet the normal we have is about 2,300 milligrams a day. The allowance of sodium in a moderate low sodium diet is about 2,000 milligrams or 2 grams. And the regular diet with no salt added may contain about 2.4 to 4.5 grams of sodium. And any diet in which the amount of sodium is drastically reduced may have possible side effects in the body. So I have to also implement this slowly until the patient adjusts. Then we have the bland diet. This is very helpful for gastritis, hyperacidity, hemorrhoids, peptic ulcers, and other GIT disorders. The dietary management of these patients, for example, with chronic ulcer disease, has been the subject of a lot of controversy, and the bland diets have been traditionally used for these patients. However, experiments still show that there is no significant difference in the response of patients with an active duodenal ulcer to a bland diet. You have to make sure that some irritants to the gastric mucosa, including alcohol, black pepper, caffeine, chili powder, cocoa, coffee, certain drugs, and tea, have to also be minimized. And you have to emphasize on how to eat. It's also very important because it may indicate what foods to eat since there are individual responses to bland diet. So you have to offer the following suggestions to the patient in regards to the bland diet. The patient should avoid worrying and being emotionally upset at mealtime. The patient has to eat when they are relaxed. And they have to chew the food well and eat slowly. The food has to be finely chewed to avoid agitation to the GIT, especially for ulcerative colitis. The patient has to also rest before and after meals. Avoid foods of extreme temperatures, very cold foods and very hot foods are not also very good for the GIT in that case. And if fruits and juices between meals may cause distress, we have to try including them with meals. And the meals must be kept small to reduce gastric acidity and distension. So the patient has to take in small but frequent meals. And some of the foods to avoid here we have, for example, the fatty meats, fried foods, whole grain breads and cereals, dried beans and peas, cabbage family vegetables, chocolate, nuts and seeds, and the carbonated beverages, caffeine, coffee, and tea. You have to minimize these because they do have irritants. The coffee, the tea, the caffeine, and then the spices in these fried foods may not be healthy for the GIT, and they may cause the situation to worsen. The patients on a bland diet may also use spices and condiments. For example, allspice, cinnamon, mace, paprika, sage, thyme, catsup, cranberry, or mint jelly and extract, and then flavorings that do not contain chocolate or vinegar. This bland diet allows a more liberal food selection than the other restrictive diets. And this diet also reduces the number of meals to 3 and increases the quantity of foods given. You have to individualize the diet to the patient according to their condition. The regular, no stimulants diet, also called the liberal bland. This is a type of bland diet. It eliminates only those items that have been shown scientifically to irritate the gastric mucosa. These I have already mentioned earlier: the alcohol, black pepper, caffeine, chili powder, cocoa, coffee, and certain drugs and tea. You have to make sure you minimize or eliminate these totally from the diet because they cause irritation of the gastric mucosa. And then decaffeinated coffees may be restricted in most diets, so in most types of bland diets. Recent studies have also shown that it causes increased gastric acid secretion and esophageal pressure, and this may cause gastric acid reflux in the esophagus. The decaffeinated coffee is only offered on the bland diet and the regular no stimulants diet if it is tolerated by the patient. But if patient shows any signs of intolerance, then you have to stop it immediately. And finally, we have the low carbohydrate, high protein diets. This diet is low in carbohydrates and high in protein, and it is usually used in the treatment of hypoglycemia. This diet will limit simple carbohydrates that are quickly absorbed into the blood. And a marked rise in blood sugar stimulates the pancreas to overproduce insulin, which will lead to a hypoglycemic state as too much sugar is transported out of the blood. And you have to individualize this diet to the patient since the hypoglycemic reactions may occur at any time for various different reasons. For example, skipping meals, inadequate calorie intake with excessive energy expenditure, and drinking alcohol may also precipitate a low blood sugar reaction. The foods may be divided into 3 to 6 or more small meals, and liberal amounts of protein and fat are used because they are more slowly digested and absorbed. This diet includes meats, fish, poultry, cheese, eggs, fats, low-starch vegetables, and limited amounts of unsweetened fruits and juices. You may also include bread, cereals, and high-starch content vegetables like corn, peas, and potatoes. Because milk contains the sugar lactose, you have to limit it to up to 2 cups a day for an adult. And finally, sweets, for example, candy, sugar, jams, jellies, soft drinks, and pastries should be avoided to help prevent hypoglycemic reactions. They should be consumed only when necessary to quickly increase blood sugar levels during a hypoglycemic reaction. And if these reactions are frequent, it's also very helpful to carry the hard candy for quick and easy use. The handy high-protein snacks will also prevent hypoglycemic reactions. For example, cheese, peanut butter, milk, and hard-boiled eggs. So in conclusion, the different types of diets that are prepared therapeutically should be individualized to the patient, and these diets should make sure that they contain adequate nutrients. In case a certain nutrient is in lack, then you have to supplement it so that the body can obtain enough of each of the nutrients in the specified diet. Thank you very much.